This vote, the yeas are 218, the nays are 214. The motion is adopted.
A bill that has been the big story in our nation for months, passing by a razor-thin margin. Tonight, President Trump's budget bill is heading to his desk as the bi-state watches for what happens next. Good evening to you. I'm Corey Stark, along with Morgan Harris. Samantha is off tonight.
This multi-billion-dollar plan will bring new tax cuts, but also slash billions for government programs, including Medicaid and SNAP benefits. First
Alert 4's Cameron Bopp is hearing from local health care providers who are worried about what's coming once the bill becomes law.
I like to say it's like a birth and pregnancy bestie.
Ebony Hooper Boateng is a certified doula based in Ferguson who founded Birthing You to give families personalized support throughout pregnancy.
In-home visits with the family to prepare for birth, talk about options, help connect them to resources that they may need.
She makes it easy to get help, even accepting Medicaid.
Finances don't have to be a barrier.
But her services and others could be at risk under changes to Medicaid funding in President Trump's tax bill. The controversial bill that's drawn bipartisan criticism has now passed both houses of Congress. According to the Missouri Department of Health, nearly 4 in 10 births in the state are covered by Medicaid. In rural areas, it's nearly half, and black mothers face the highest risks during pregnancy, 3 times more likely to die than white mothers due to pregnancy complications. Though most are preventable, Medicaid cuts, Boateng fears, could widen the gap.
These cuts will impact real people who already are facing hardships.
And the impact goes beyond doula care.
Some hospitals simply won't be able to maintain their current set of services. Or in some cases, potentially even stay open.
Dave Dillon with the Missouri Hospital Association says cuts to Medicaid could push already struggling rural hospitals to the brink.
About half of rural hospitals are operating with negative operating margins presently.
Hospitals like HSHS, St. Joseph's, and Highland, another in Breeze, both about an hour from St. Louis, could be among those affected. Chris Clay oversees both.
It will put organizations in a position where they'll have to make decision on services or service lines, meaning to continue providing a service or not.
Fewer services and fewer insured. According to Congressional Budget Office estimates, more than 500,000 people in Illinois and over 250,000 in Missouri could lose their Medicaid coverage.
What that translates to is people no longer have a health insurance product, so they're going to forego receiving care, and that means they'll be sicker when they come to us.
Now, once the bill becomes law, a lot of changes beyond health care. Here's a timeline of those changes. Starting sometime this year, tips and overtime pay will no longer be taxed, but there are caps on that. It isn't just any and all tips. By 2026, new rules for work requirements for Medicaid will start kicking in, with most states seeing those mandates by the end of that year. By 2028, deeper cuts to food stamps and Medicaid funding would take hold. And for drivers, tax credits for electric vehicles and home energy upgrades would begin phasing out by late next year. We know a lot to keep track of. We should also note there is a $50 billion rural health care relief program set to start next year under the president's bill. But the Missouri Hospital Association, who we just heard from, says that relief won't arrive fast enough, and it could be outweighed by the Medicaid cuts that threaten to hit hospitals hard in the years to come. Cameron Bopp, First Alert 4.
A lot to go over there. All right, Cameron, thank you. Let's turn now.